Okay, so serratus anterior, kind of the closest muscle in the neighborhood to keep kind of comparing the two is subscapularis. But serratus anterior is going to attach all the way to the medial border of the scapula underneath on the anterior side, right? So subscapularis is going to cover, a bigger attachment surface of the scapula, whereas serratus is going to go all the way to the medial border. But where you actually palpate and can see and feel serratus anterior is on the lateral aspect of torso, on the ribs, and on people who have, well-developed muscles and very little body fat. You can actually see on the sides, like little tiny muscles. Even on someone who's super, weightlifter, they're still kind of thin muscles attaching to the ribs. So the word serratus is kind of like a serrated knife is where it kind of comes from, right? So you have like these little like kind of serrated bits attaching to each of the ribs. And this picture on the bottom is kind of nice because it just shows like highlighted in the terracotta color, like where you would actually like see the serratus compared to the muscles around it. Main thing I think about serratus, like clinically, is that it helps hold the scapula onto the torso. So for people who have winged scapula where their scapula pop up, their serratus anteriors are weak, and so you'd want to help them strengthen their serratus anterior. I would say that is the most, I would say that's the most often you want to work with serratus. Are there times you like to work with serratus?
I just like to include it with other stuff that I'm doing. I hardly ever write for it.
Thanks.
How would you strengthen it?
Great question. As massage therapists, of course we can loosen and relax and lengthen stuff easier than we can strengthen stuff. You basically have to have the client actively do the motion that muscle does. So, one of the things is you can have them, like if their hand is forward like a punch, you can have them push against it in resistance, is one thing that you can do. Other things you can do are like the rhomboids because of the adduction motion. No, I'm sorry, I said that backwards. Just do that fist forward there, pushing it like they're throwing a punch and you're resisting it. Yeah, for the abduction of the scapula. Yes.
How does this does it kind of affect your breathing since it's attached to the?
Yeah, great question. It can help with inhalation, and so that's actually a great question and a great other time to think of serratus is that a lot of times when your clients have been coughing a lot, all of the muscles related to breathing get really kind of jacked up and irritated. So that's another time it's nice to talk to serratus is like after a cough. Yeah, but it can help with inhalation. Yeah, great question. All right, so again, I'd like to start with the O, then the I, then the A. So our O is the external surfaces of the upper 8 or 9 ribs. And in the pictures of Trail Guide where they just show the little, attachments, it's nice because it shows what part it actually attaches to. And so each little individual rib. So, kind of more on the sides. And then the insertions, interior surface of the medial border of the scapula, because the scapula can move more than the ribs, right? So that's the side that's more mobile. And so that's on the front, which is hard to picture in a drawing like this. But if you picture underneath, right, anterior surface of the medial border. And then our actions, abduct or retract, abduct, protract. Gosh, I'm having a hard time with the scapula today. Abduct, which is protract. of the scapula, upwardly rotate the scapula, depress the scapula, and hold the medial border of the scapula against the rib cage. And it's that last action, that kind of comes up a lot with if people have winged scapula. It's not doing that part of its job. Regarding depressing the scapula, that one might be a little difficult to visualize. If you can imagine or see how a lot of those fibers are kind of angling down. So if they were pulling down towards the ribs, it could pull the scapula down. Would be when it's like stretched, and so then pulling them down would be its action. So that's another one where like people tend to have their shoulders more up, and so that's another one where like it's weak. So then you can have them be bringing their scapula down to help strengthen it. Yeah, when we have a palpation lab, you can feel this better because it's a little bit of a hard one to feel on yourself, but basically on the sides, if you palpate like with flat fingers up and down, you can feel where the ribs are really smooth and slippery. And if you feel like any thicknesses and or fibers, that would be the serratus. Now, the lats are so big and strong, you want to feel anterior to the lats. And these can be real tender. So don't be surprised if, your palpation is tender. Any other questions on serratus?